My name is Alayna Rakes. I'm 41 years old and I'm from Bucks County, Pennsylvania. I had multiple post-procedure follow-ups. I had one the very next day. I had another one at 2 weeks and then at another month. So I kept going back to my surgeon to make sure that everything was healing the way that it should be and that my skin was, my scars were going away, the implants were settling into place, and I understood that they changed through the healing process. And my surgeon made me very comfortable with all of the follow-up visits. I thought that he was very thorough. I felt that during the recovery, I was able to get back to exercising faster than I thought that I would be able to. I just took it easy and let my body heal in time. So at one of my follow-up visits, about 3 months out, my surgeon cleared me to go back to my workout routine, starting lightly with my upper body work, and eventually, when I felt comfortable, building up to my regular practice. And I wanted to make sure that my surgeon cleared me to do any activity before I moved forward with that. I love my results. I'm super happy. I feel like the volume that I was looking for to restore that volume is back. It's been a really great experience. So going through the healing process, things that I was really looking forward to doing again was picking up my cat and being able to carry my cat. I also really wanted to get back to my Pilates practice. That was really important to me. And just feeling like 100%. After my surgery, I really was looking forward to summer and trying on my bikinis and bathing suits, just seeing what fit, if I needed to get a new one, because that's always fun to buy something new. Just going back to my old clothes and seeing how much better they fit, and how old items looked even better. If a friend came to me and asked about my augmentation, was considering getting an augmentation, I would say check into other people's experiences. Talk to your friends. You know more people than you realize that have done this procedure. When I started looking around, I was amazed how many women that I was friends with, that were family members, had a breast augmentation and were super happy with their outcome. I would say trust your surgeon. You want to go in there with an idea of what you're looking for, but your surgeon knows best, and they're going to be able to recommend a profile and a size to you that's going to give you the result that you're looking for. So as a woman, I feel that so many of us are busy, and we don't always look for opportunities to do something for ourselves. You feeling like you lost volume like I did, or if you just are looking for a fuller look, it's been it's really been a great process. I would say if someone is looking into their breast augmentation, do your research and then find a person that you trust, find a surgeon that you really feel comfortable with.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.